Hi, everybody. It's Joni from Safe at Home Physio. I have one of my dearest friends with me today, Nadine Cram. She is an ICU nurse, and she's worked in several areas in the United States, including Seattle, and lives in Washington State currently. Hi, Nadine.
Hi.
On there. So, can you tell me and the listeners about yourself and kind of where your journey started and what you do now as a nurse?
Sure. Well, I started in Canada. I was trained at Dalhousie University and decided to come down to the United States. My first job was actually in South Florida. Eventually, I became a trauma ICU nurse. And so from there, I've just done a lot of different ICUs. And I started traveling and ended up in Seattle, where I worked in neuro ICU and a cardiovascular ICU. So
Heart attack. So what does a heart attack look like? What are some of the things that we should think about?
So for men, I'll go into my spiel because I've been a really big advocate at looking at the differences between male heart attacks and female heart attacks, because they're very different. So for men, it's the clutching chest pain. It's the pain down the left arm, sometimes up into the jaw. Exactly. And that's what you see in the movies often.
The
For
throat,
females,
right?
it's not. Well, for females, it's back pain. Yeah, back pain. It's nausea. Oftentimes they'll vomit. They'll get very diaphoretic. So it's very different. Females oftentimes just think they have a stomach flu, like that or they have some back pain and it's a shooting back pain. So I'm trying to educate females a lot into, if you get these signs and symptoms and you just feel like something's wrong, call 911. It's just safer.
Oh, so what's the difference between back pain that I would treat as a physio versus the back pain that may actually be a cardiac issue? Like, does it come on suddenly? Is it sharp? Is it?
So this is it's very acute, it's very sharp, and it's often like with the nausea and the stomach pain. So,
You just feel ill
and
all
it's
of a
usually
sudden for no
mid-center, I
reason,
think they say.
and gets worse with exertion?
Yep.
Like if you try to.
It's very different. It just depends. It depends on what type of, if you're having a full-on myocardial infarction, or it's just going to get worse, no matter what you do.
Right.
If you're having angina, it's just very different. Symptoms. If you feel like there's something wrong, just call 911. It's safer. And I say call 911 instead of getting someone to drive you to the hospital, because when 911 gets there, they've got an AED.
Right.
So
And if you
they
have
can get to you quicker than you can get to a hospital.
do you find that the people that come
Yeah.
in typically will have heart attacks at home, or like when do you typically, like, when does this normally present?
Usually it's at home. Usually it's and it can be at work, times of stress. People are working at home, doing exertional activity, or that, it just varies.
If something's really off and you feel extremely ill and you have any acute pain, which means it comes on suddenly and you didn't hurt yourself, it's not like you fell down the stairs and you have all this back pain all of a sudden, call the 911. So the more you do the training, the better you are at presenting to an emergency and helping the person. So,
Yep.
okay. Well,
And practice makes perfect. I'm not great because I'm a nurse. I'm great because I've practiced it so many times and I've done it so many times.
well, you're great anyway. You're one of my favorite people.
Oh,
So I'm so glad that you
thank
came
you.
and talked to us today. And thank you so much for all your knowledge and experience. Thanks so much for your time, everybody. And go get that CPR course and find out where the AEDs are near you. Hey everybody, thanks for watching this video. I just want to let you know quickly about a new special I'm running for all new clients. It's only $69. That's a $150 value for a limited time only. For that, you get a visit one-on-one with me in your home for 45 minutes. We'll screen for COVID before I come to make sure everybody's safe. I'm going to review your medical history and medication with you, check your pulse, oxygen, and blood pressure, and then we'll get right into it and analyze the movement and strength of your problem area, scan for balance and coordination issues, and review any equipment needs you might have. Then I'll analyze the findings and give them to you and tell you what the next steps are. So if you're interested or you know anybody who may benefit, please contact me at 902-809-1793, or you can book directly at safeathomephysio.ca. Have a great day.